Alright, we're going to start on page 49 of your lab packet, objective number 10, which looks at the spinal cord. This is the model that we have. You do have a picture in your lab packet of the spinal cord as well. I'm going to concentrate more so on the actual models. You guys can fill in your pictures of your lab packet when you're ready. We start with the dorsal and the ventral horn of the spinal cord. One of the things you notice about the spinal cord is that there is gray and white matter, as you can see with the discoloration of the tissue here. You see that some of it is a little bit of a discolored, darker color, which would be the gray matter, and the other material around it, which is a lighter color, would be considered the white matter. And this is found both in the spinal cord and in the brain, gray versus white matter. When we look at the horns of the spinal cord, these would be part of the gray matter, and there are two different horns that we're identifying. We have the dorsal horn, which is this more narrow horn right back here, and that would be on both sides, be the dorsal horn. And again, you can see how narrow it is. Whereas the ventral horn in the front here, the gray matter area in this particular portion of it is very wide. So this would be the ventral or the anterior horn. And again, it's just these small little areas right here in the back being the dorsal horn, and in the front being the ventral horn. Now in the center of the spinal cord there is a canal, and you see this little dark spot right here. This would be the central canal. And what I do want you to know about the central canal is this is where we're going to find some cerebral spinal fluid. The reason that we're talking about these dorsal horns here, if you will, is because they pertain a little bit to the roots that we're going to be referring to. We have a dorsal root and a ventral root. So we're going to skip around a little bit on your lab packet on page 49. I'm going to start with the dorsal root. If you look at the spinal cord now with the roots attached to it, these would be the roots right here, both coming off of the dorsal horn and coming off of the ventral horn. These would be considered the roots. And notice how they come and merge together to form a spinal nerve, which we'll talk about in a minute. Let's first start by looking at the dorsal root. As you can see here, this is the dorsal root because it's coming off of the dorsal horn that we just talked about earlier. One other unique thing about the dorsal root is that there is a large bulge to it. Right underneath my finger you can see how it does thicken up right here. Now if you look at the other root, the ventral root up here, it does not have that thickening. This thickening of the dorsal root is referred to as the dorsal root ganglion and is only associated with the dorsal root. Other things that I want you to know about the dorsal root. Why are we talking about this? Well, these are where our sensory neurons would reside. And if we know anything about sensory neurons, sensory information is always coming to the central nervous system. In this case it would be the spinal cord. So the action potentials of the sensory neurons are coming towards the spinal cord, and in this case the dorsal root is always associated with the sensory neurons. Now let's take a look at the ventral root. The ventral root is in the front. Notice how it's coming off of the ventral horn, and they come off, and it does not have a ganglion like the dorsal root. But the ventral root is associated with the motor neurons. And motor neurons are going to send information out of the spinal cord into different types of effector organs, which we'll talk about at a different time here. But both of the roots, as you can see, are going to merge together and form one spinal nerve, sometimes called a mixed nerve because it has a little bit of sensory neurons in it, it has a little bit of motor neurons in it, and they both merge together to form a spinal nerve. So these spinal nerves, there are 31 pairs in the spinal cord, there are 12 pairs coming off of the brain. Now just to take a second here to look at what a spinal cord segment is. A spinal cord segment would be all of this dorsal root, ventral root, and the spinal nerve, and that whole entire area of the spinal cord would be considered a spinal cord segment. I'm going to just kind of shift over to the picture that we provided you in your book here. you can see here, these would be the spinal cord segments that we have sectioned off right here. And again, it includes everything that we just referred to in regards to the spinal nerve, the dorsal root, ventral root, and the horns. In your book on page 255, it shows a picture of the spinal cord, very similar to the picture you see in your book, which you can utilize to label it if you need to. And one of the things, though, that we have to talk about are what we call the meninges, or the meningeal layers. These are membranes that we find not only around the spinal cord, but also around the brain. So in your book here on page 255, they provide us a picture of the meningeal layers. And there are 3 layers to them that we need to know. The first layer is called the dura mater, and this is the very outside meningeal layer that you see right here. Now, a couple things about the dura mater. The name dura means durable, so this layer itself is extremely durable, and it is the outer layer. The middle layer is called the arachnoid mater. And you can see that here, this middle layer, it's somewhat of an intermediate layer in regards to thickness. It's not as durable as the dura mater, and it's not as thin as the next one that we'll be referring to. But it gets its name arachnoid because arachnoid means spider. And when we pull this tissue apart, it does have a sense to, it does have a view of a, like a spider web, if you will. As we pull that tissue apart, it does look like a spider web. Now, you don't see it in this particular picture, but we just have to imagine right underneath the arachnoid mater here, there would be a space right underneath it. And this space would be found again around both the spinal cord and the brain. And in this space, this is called the subarachnoid space. So it's just, sub means just below the arachnoid mater, so we call it the subarachnoid space. And this is where we have most of our cerebral spinal fluid flowing. So we talked earlier that we have the cerebral spinal fluid in the central canal of the spinal cord, which is pretty minimal. Most of it is found around the brain and around the spinal cord in this space called the subarachnoid space. The last layer is called the pia mater, and this layer is extremely delicate. In fact, the word pia means gentle mother. I'll zoom in just a little bit here. And you can see how this layer in particular is going to be right up against the nervous tissue here. In fact, I usually describe it as being spray painted onto the actual nervous tissue because it's extremely hard to actually peel away if we were doing any type of dissection with it. But this is your last layer, and so all 3 of these layers, the dura mater, the arachnoid mater, and the pia mater, along with the subarachnoid space with the cerebrospinal fluid, is there to protect the spinal cord and the brain. Okay, next we're going to look at these different nerves that come off of the spinal cord. There are a few of them that you have to recognize, and also looking at what we call plexuses. So you see on page 50 of your lab packet, we do have on the left we have a bunch of different plexuses, and one of the things we have to identify is what is actually a plexus. Well, when the nerves come off the spinal cord, sometimes they like to braid together and join with other different nerves that are coming off. And this braiding effect and joining effect of each of these nerves is considered to be a plexus. So in your book on page 261, they show you the spinal cord running down, and they show you the nerves that are coming off of the spinal cord. And in some areas of the spinal cord and the spinal nerves are actually merging together or braiding and forming plexuses. So there's only one area of the spinal cord and the spinal nerves that are not plexusing. That would be in the thoracic area. So if you look on your sheet there, you'll see that there is some nerves that are coming off in the thoracic region of the spinal cord, and you can see that right here, which are not plexusing, and these are called your intercostal nerves. And I just wanted to start there because this is the only place that we will not see a plexus, individual nerves coming off. These are called intercostal nerves. Now, what do they serve? They're going to serve the muscles between the ribs. So you may be asked what each of these may serve. Let's look at the cervical plexus up at the very top. This is right where your neck is. So you have some spinal nerves that are coming off, and they are plexusing. I'm going to zoom in. And these are called your cervical plexus. Now there is no one in particular nerve that you need to know coming off of there. For this class, you just want to know that that plexus up there at the neck is called the cervical plexus. The next plexus is just below that, immediately following it. And this one is coming off right where your shoulder is. So you can see your book kind of draws in the shoulder here. This is your brachial plexus. And this one's probably the most commonly injured plexus because it's extremely close to the surface of the skin. Some athletes who play football or any type of contact sports may get an injury to the neck area, which would affect their brachial plexus. Now, as you see on your sheet, there are 3 nerves that you have to identify that come off of the brachial plexus. I'm going to shift my attention to one of our models that we have. And here we have our spinal nerve model, if you will. And way at the top here, this is where the cervical plexus would be. And then right at the shoulder here, this would be the brachial plexus. Now if we follow that brachial plexus as it goes down the arm, we're concerned right there in the forearm. There are 3 nerves that are situated next to each other. The first nerve here, that is on the thumb side and on the side of the bone called the radius, we call the radial nerve. In the middle, the nerve that runs in the middle of the forearm is called the median nerve. And the nerve on the inside, or the medial aspect, which rides right along the ulna bone, is therefore called the ulnar nerve. So you notice how all 3 of those nerves are going to be situated side by side. Now if we go back up and we see our brachial plexus right here, notice that we are now in the thoracic region, and look how all these individual nerves are coming off. These were those intercostal nerves that we were talking about. You can see how they do not, when they come off, they do not braid with one another at all. Okay, our next plexus is called the lumbar plexus. So right after the thoracic, their intercostal nerves, if you will, we get our very first plexus right here. And this would be your lumbar plexus because it's found right where the lumbar vertebrae would be found. And there's one nerve that you want to know coming off of it, and it comes right here, right along the femur, if you will, and typically associated right with where the femur is. This is called the femoral nerve. So the femoral nerve is coming off of the lumbar plexus. Now immediately below the lumbar plexus is the sacral plexus right here. And this is your last plexus. And there's one nerve, which happens to be a very, very long nerve, goes from your buttocks all the way down past your knee. I'll zoom out just a little bit here. It goes past your knee and all the way down into your lower leg to your ankle, which is called the sciatic nerve. So it's a very long nerve. It's the only one that we want you to know coming off of the sacral plexus. So you can see in your book there that the femoral nerve and the lumbar plexus are going to affect or work with your lower abdomen region and anterior thigh. And your sacral plexus is going to affect your buttocks, your posterior thigh, and your leg and your foot, considering that the sciatic nerve is so long. So there we've identified the nerves coming off of the spinal cord along with the different plexuses that we may see. This is the model that we do use, starting from the head and working our way down and knowing where those plexuses are found. Again, you can find that on page 261 of your book to some degree.